A lot of this crisis is because of fentanyl that's getting mixed in with a lot of the street products, and that causes people to die much more commonly than they would normally if they knew what they were using.
Fentanyl-laced street drugs are becoming a deadly problem among drug users in San Diego. The county's fentanyl overdose mortality rate in 2017 was 2 times higher than the California rate, according to health officials. Nearly 300 deaths in San Diego County were attributed to opioid overdoses, with nearly half involving fentanyl. Dr. Richard Clark is director of the Division of Medical Toxicology at UC San Diego Health System.
There's no doubt that the number of deaths have gone up. There's no doubt that the number of ER visits have gone up, although I don't have the numbers. And I would say that the vast majority of the problems associated with those is due to fentanyl in the heroin.
He's seeing the dangerous trend firsthand at UC San Diego Medical Center's emergency room in Hillcrest, where he estimates a 30% rise in fentanyl-related cases.
Most of the people that I see now that have problems with heroin are certain it's laced with fentanyl. And they feel like they're using the same dose that they've always used of heroin, and now all of a sudden they're having more trouble with it and having problems with toxicity.
He says the white powder substance is 10 to 100 times more potent than heroin. Even small amounts of the opioid can cause respiratory arrest. That's why the California Public Health Department is providing test strips at needle exchange locations across the state that people can use to check their drugs for fentanyl. Dr. Clark says drug users should also carry the opioid overdose reversal medication called naloxone.
That's a little bit like an insurance policy, but if you are using by yourself and pass out, it's not going to do you any good.
He says the best prevention is not using drugs at all. Susan Murphy, KPBS News.